Howdy, y'all. This is Dr. John here again, ready to do another Thursday Q&A. And I want to thank you because we got some great questions, I think. I don't remember what they all are, but we got a lot of them, and I want to thank you for sending them in. And I'm going to give you just a couple minutes for people to get on, and then I'm going to start going through the questions. And number one, I want to thank Patty. I don't have permission to use her last name, but I want to thank Patty, who every week sends us a series of really, really good questions. And so I want to start out by honoring her requests and going through some of her questions. And some of them I'll probably just hit briefly, and some I may go into a little more detail. So what you got? Oh, three questions. So all right, I'll just go ahead and read these from here and not have Catherine read them to me. So it says, hi, Catherine. How to know if one has B syndrome, BI, what it is, and best treatments, i.e. herbs, acupuncture, formulas, lifestyle modifications, etc. Now, that's a really good question. So first, B syndrome is a little bit of a catch-all in Chinese medicine. It's almost like using the term arthritis in Western medicine. I don't mean they mean the same thing, but it's like someone says, I have arthritis. Well, yeah, you already knew that. Arthritis just means you have pain in a joint, right? Or inflammation in a joint. So it's not, there are 200 types of arthritis. So you didn't really learn much with that title. And it's similar in a way with B syndrome. B syndrome generally, and again, we always have to remember that Chinese is not a language at all like English. It is a language of characters. So as they say, one picture means 1,000 words. Well, in Chinese, that's pretty much true. Maybe not 1,000, but it can mean a lot. When you start looking up what we would consider pretty common terms in medicine, in Chinese medicine, when you start to get into a dictionary, looking up the meanings of those, like look up qi, QI, and there, depending on the dictionary, will be 6 to 10 or more different definitions. Anything, and a lot of them are not, in some of them, what we consider qi, like energy, is not listed at all. You'll see air, oxygen, etc. So it's a little tricky, but back to B syndrome. So B syndrome basically means, and so I say that because direct translation is very difficult. But generally, when I'm talking about B syndrome, or my teachers are talking about B syndrome, they're talking about obstruction syndrome. They're talking about a condition that is blocking the free flow of qi and blood, qi and or blood. And so it's a blockage syndrome. And so there are many different types. The most common are cold B. That's a blockage by cold. So it's cold that has gotten into the tissues and into the human being and is causing obstruction and pain. And the Chinese say, if there is free flow, there's no pain. If there's no free flow, there is, by definition, pain. So what we're looking here is a lack of free flow of qi and or blood through the tissues and through the meridian system. So cold can do that. Damp can do that. It's a major player. And the damp B is the heavy. Oh, God, that hurts. It just aches, and I don't want to do anything. Cold is a little sharper in a way, generally not quite as painful. And then we have wind B. And wind B is characterized by the fact that it's like wind. It moves all over. Today you wake up and your elbow hurts. Tomorrow you wake up and your right ankle hurts. The next day you wake up and your neck hurts. I suffer mostly myself from wind B. I never know. I have significant arthritis in my feet and significant arthritis, less, but still significant, in my wrists and thumbs. I honestly have no idea what I'm going to feel like when I get up the next morning. I can go to bed with pain in my right wrist and wake up with pain in my left foot or my left ankle. So that's wind B. It moves around, it flows. It's just as unpredictable as the wind in terms of where it will pick up. Now, typically, each of those conditions gets worse in climactic conditions that are consistent with the type of B syndrome. So when it's cold outside, people with cold B suffer more. It's like, oh my God, I just don't even want to walk. It's cold outside. I know it's going to hurt. Damp B. I have relatives. I remember when I was a kid, they would say, oh, Aunt Mary has got the rheumatiz. She can tell you 2 days in advance when it's going to start raining. And that's true. The people with damp B pain can tell you when the barometer's changing, when the barometer's going up or down. And part of that is, and I don't know how much of it is, but part of it I know is because when the barometric pressure goes up, there is literally more pressure on your body. Now, you wouldn't think it would be enough that would make a big difference, but it actually is. We just are so used to those changes, we don't notice them consciously, but our organs notice, and our ankles will notice if we have bad problems, cold or damp B. So when it's high barometric pressure, the tissues are actually getting squeezed, okay? When it's low barometric pressure, the tissues literally expand, right? And either of those can cause significant increases in pain. And in many people, they both do, right? They'll cause increases in pain as the tissue either gets compressed, like if someone has bursitis, which is swelling of the fluid-filled sacs, or some form of synovial fluid problem where there's too much fluid in an area, and you start pressing it, that can be very painful. On the other hand, if the tissue swells, it can press against nerves, and that can also be very, very painful. So B syndrome, in fact, I did a little research a while back. I don't do time well. It's probably a year now, looking at changes in barometric pressure, and I was a little bit surprised. The death rate, the mortality rate goes up when the barometric pressure increases. Not only that, the death rate goes up when the barometric pressure decreases. Either change will cause more people to die, more heart attacks, more strokes, more cardiovascular problems. And I was a little surprised by that. I thought, yeah, pain, I get it, but I didn't really think about more people dying. So that's painful obstruction syndrome, or B syndrome. Now, there was a very famous, one of the four great physicians of the Jin Yuan period, was a fellow named Liu Wansu, Liuwansu. And he was the leaders of one of the schools of medicine at that time. And he developed the theory of similar transformation. And what he said is that since human beings are warm, right? That's how you can tell if someone's alive. Their temperature is much warmer than most of the surrounding areas, unless it's the middle of the summer. And so that's how you tell people are alive. They're warm. And that is a characteristic of being alive. And he said, any guest pathogen, so we would consider those bacteria, viruses, yeast, etc., a guest. It doesn't really belong here. It's overstaying its welcome. Any guest pathogen will become hot in the long run because of the very nature of the human body. And if you think about this is very accurate. You get a virus, you get a bacteria, you get yeast infections. And at first they may start out with no temperature, but over time, they may start with a temperature, but they may not. And over time, you'll develop inflammation from all of those things. From each of those things, you'll develop inflammation. The tissue will get hot, and you'll develop hot B pain. Okay, all of these conditions are conditions of pain. So when someone says B syndrome, they're talking about a pain syndrome caused by obstruction. Now, let's see. Patty had a couple other questions. And best treatments. almost everything, depending on the type of condition. So Patty wrote herbs, and the answer is yes. There are very, very specific herbs to treat the different types of B syndrome. And so generally, you'd be looking in the categories of herbs that dispel stasis. That would be blood that's blocking an area, and that's a big cause of B syndrome. You'd be looking at herbs that clear heat. You could be looking at herbs that stimulate yang or support yang or fortify yang, which is heat. So if it's cold and damp and windy, having more heat in your system can help clear it out of the way and open up the channels. So anyway, there are several different categories that can apply here. Acupuncture, absolutely. Acupuncture has been used for bee pain probably since the first needle was inserted in somebody. We use acupuncture for bee problems all the time. Now, often, if it's cold bee or damp bee, you're going to want to use moxibustion with it. Moxa is the burning of very specific herbs over the area. And that can be done. You can buy long cones, long sticks of moxa. It looks like a smudge stick that you would use with sage, but this is herbs, other herbs, usually 16 different herbs are involved. And you burn those, and it draws heat into the acupuncture points. And it's very interesting when you see demonstrations, if they use true moxa, say on a watermelon, it will actually heat the watermelon and change the character of it all the way through to the other side. When they burn something like a torch or they burn a match, it doesn't do that. It just burns on the surface. So there is something special about the moxibustion it really increases the effectiveness. My favorite use of moxa is called needle moxa, where we insert the needles and then we put some moxa. It's called moxa wool. We put moxa on the tip of the needle and then light that, and that carries the heat directly into the area. Now, there are some acupuncture sets that create heat in the needle when electroacupuncture. When the electrodes are attached, it actually sends heat into the points. I believe that's very good. I believe it's not as powerful as needle moxa, but it's something. Like in our clinic, we have so many people with allergies and autoimmune conditions. We just don't use moxa because people wouldn't be able to stand the smell, because it smells like burning herbs, frankly. Even smokeless moxa is too much for many people. And then it says formulas. There are whole sections in any herb book on formulas for B syndrome. And so if you simply look in the indexes in, say, Bensky and et al. Wrote a great book on herbs. Chen and Chen wrote a great book on herb formulas also. And if you just look at B syndrome in the back, it will break it down by the different types of B syndrome, and you'll see very large lists of those formulas. And you got to figure, the Chinese really specialized in this. They were an agrarian culture that many of the people spent most of their lives walking in ice cold rice paddies, or at least cold rice paddies. And so they were just surrounded by dampness. Then they went home. They did not have heated huts, cabins, whatever they lived in. And so they went home cold and wet and really didn't dry out very well, and they didn't get heated very well. So B syndrome is just at the core of many Chinese treatments and illnesses. So it's very easy to find. Lifestyle modifications, absolutely. Depending on what the particular problem is, you might need to stay out of the wind a little bit more. You might need to stay out of the cold a little bit more. You might need to stay out of the damp, and or wear different clothing to go with it. Also, diet can play a role. For these colder obstructions and damp obstructions, you want herbs that bring heat to the center, right? And so things that we associate with, say, Mexican spices and African spices actually bring the heat to the surface. right? They make you perspire so that you can perspire and then cool your system by having that process. What we're looking for here are the herbs that bring the heat internally, things like cinnamon. There's three different types of cinnamon that we use, actually. Each of them has a slightly different usage, but they're all good for bee syndrome. Ginger brings heat internally. The herbs that you see used in England that they put in their tea, right, et cetera, bergamot, those things all bring the heat to the center of the body, which is what you want for painful obstruction. There are also patches that you can put on cold, damp, or wind bee that have different things in them, anything from red pepper, right, to menthol, to a whole huge range of things. We have dozens of different liniments and different types of paint patches, yeah. Thanks, that you put on. And we have dozens of different types, and they're very, very effective. So that's treating it externally, and then you can also treat it internally, lots of things. Now, once it turns to heat, then you're going to want to use different formulas, different acupuncture points, and a little bit different lifestyle choices. For cold and damp bee, things that are absolutely superb are hot tubs and saunas. Wind bee, not so much, but it's still okay. But for cold or damp, man, there's nothing better than a good hot tub. I'll tell you from personal experience, that's the way to go. Okay, so remember Luan Su and the theory of similar transformation. Okay, question number 2. Like I said, I'm going to give Patty priority because she keeps sending great questions. Vitamin D with K2 or light therapy with K2, which is better for the body to obtain the vitamin D needed for good health in the winter months? Both. Mostly, I would, if you have good lighting available, that will create vitamin D, right? So a lot of light systems are the wrong wavelengths, and it won't help you create vitamin D. But if you have one that will create vitamin D, then that's the best choice, because while you're creating vitamin D, you're also changing a great many other chemicals that are in the skin and on the surface of the body. You get huge changes in types of cholesterol and how that cholesterol is used, et cetera. And I'm glad you mentioned with K2, because you want to do K2 either way. Now, you may not be able to get quite enough D3 from the light. And if you can't, then supplementing with a pill or a liquid, et cetera, is also fine. But the best is light therapy. Okay. Sometimes when I get acupuncture treatments, I can feel a pain afterwards where a needle was placed. Is this normal? Well, when it happens to me, I always tell the patients it was normal. No, actually, that is not, in my opinion, normal. Now, when it comes to acupuncture, you can ask 100 different acupuncturists a question and get 100 different answers. I mean, about every aspect of acupuncture. However, having studied with some really, really, really good people, I have not and treated thousands, tens of thousands of patients. I believe that when that occurs, it is generally a mistake. Now, when we needle points, some points always hurt. Some almost never hurt. We know that going in before we do it. Now, there's something called Da Qi, which is really the arrival of qi. And there's some arguments about what that means. But essentially, if you look at the classics and how they describe it, it means the patient feels a sensation. And depending on what type of tissue the needle is in, there are about 8 different types of receptors. And depending on the nerve that is near where you insert the needle into the tissue, you're going to stimulate one of those different types of receptors. And each one gives a different sensation. Some give a really deep, like, oh God, like it's being pressed. Some give a sharper sensation, etc. Now, the acupuncturist will generally feel this in their hand at the same time. It's almost like going fishing. Those of you that have done that, and particularly for small fish, where you're sitting there waiting to feel them, and then you feel the bite, and then you set the hook. It's kind of like that. Is a sensation I feel when I'm doing acupuncture, and I know that I'm getting Da Qi, because whenever I feel that, they feel what they feel. So that's very purposeful. And there are many treatments that says it's useless unless you get Da Qi. Now, some treatments, that's not as important. The needles are very intelligent. They know what to do. And you don't always have to get strong Da Qi, but there are some points that you absolutely must. Now, if it hurts for a few seconds, I tell people it's like an ant bite. That's perfectly normal. If it lasts for a minute, that could also be normal, because you're opening the channels and the qi is starting to flow. And it's like if you had a pipe that was jammed and you suddenly started pushing water through it, you'd have more pressure. And when I've needled lots of people where I think that occurs, where there's been no energy flow. And you can feel this with the hands, by the way. This isn't, well, it's a little esoteric, but it can easily be learned by someone that's committed to learning it. And you can feel where the qi is not moving. And so you can needle around that. They'll go, whoa, that feels really weird. Is that okay? And then you feel, and it's like, now it's okay, because the qi is moving and the pain will go away. But if the pain lasts, and rarely, but occasionally, you put the needles in, you leave the room, 20 minutes later, suddenly there's that type of sensation. And it seems, from my observation, that at that point, then the qi has moved enough that it's hitting one of those blockages and forcing it open, or gently guiding it open, however you want to look at it. And one of the reasons I believe that is I've never had a patient have that sensation at the same place twice. Once it gets open, it seems to be open. But even then, this should not last very long. It should not be strongly painful, in my opinion. If the pain persists during the treatment and after the treatment, my experience from treating lots of people who've had that experience and then come in to see me is that the acupuncturist hit a nerve. Okay. Now we want to get right next to the nerve. In fact, there are points where I literally pull the nerve out of the way. There's a point here in the elbow where I pull the nerve out of the way, insert the needle, and then let the nerve go so it comes over and touches the needle. And that gives a very powerful treatment. It doesn't hurt at all, but it gives a powerful treatment. But we don't want to needle into the nerve, because that obviously damages the nerve. You got a sharp object going through this nerve tissue. And there are several points that I've seen, particularly young acupuncturists needle, where people had pain for weeks. One of the most common is this point here called pericardium 7. And when I'm teaching, I never have students practice on that point, because the chance of them hurting one of their fellow students is just too high. So if it persists after treatment, I don't like that. Again, that's my opinion, and you may find people to disagree. That happens all the time. Okay. I think that answers those questions. And Catherine, what else do we have there? Hemochromatosis. Big word. What is it? And is there info on how to treat, when to treat? Does TCM treat this? Example, is there a pattern? Every condition, anything you can imagine, has a pattern in Chinese medicine. Okay? There's always something. So hemochromatosis is considered as a disease. It's characterized by high levels of iron that have accumulated in the organs, often called the parenchymal organs, so liver, heart, kidney, pancreas, etc. It's also a problem in other tissues, but it's in those parenchymal tissues, organs, that it can be lethal. And that accumulation causes toxicity in the organs. And the most common cause is severe iron overload. Now, this is usually caused by a gene mutation. There are a few other secondary causes, but almost always by a gene mutation. Now, in any person, excess iron levels are toxic. If you take an iron needle, an iron nail, that's what they call those things, and you leave it outside, or you take a can or a pan, a cast iron pan, and you leave it outside, it's going to rust. Well, rust is evidence of oxidation. So oxygen has reacted and has caused these oxidative compounds. The same thing will happen in the body to the iron in your body. So the physiology of the body itself is incredibly careful with iron. It is not stored by itself in the body. It's stored combined with ferritin. And so often there's a misunderstanding, and people think that iron and ferritin are the same thing. And often ferritin is used to measure iron levels. And there is some validity to that, but not as much as is generally believed, because you can have perfect iron levels and low ferritin levels, and you can have vice versa. And so understanding the whole piece of iron overload is very, very critical. Now, in my practice, I'm constantly, in treating children, trying to push their iron levels up. Kids often eat foods that are kind of low in iron. Children tend to be a little pickier eaters. And so often their iron levels are too low. In attention deficit problems, 80% of the time I fix those so kids don't have to go on drugs just by getting their iron levels up. Iron carries oxygen. If there's not enough oxygen getting to the brain, you're going to have attention deficit problems. You're going to have hyperactive problems. So 80% of the time, it's as simple as increasing the iron and ferritin levels in the kids. In menstruating women, I'm often having to work to get the iron levels up, particularly if they happen to be vegan or vegetarian, because heme iron, the form that's found in meat, is very easy to absorb. You can have a moderately acidic stomach, acid levels 3 to 4, pH levels, of 3 to 4, and absorb the iron. Vegetable iron, if you read like a can of spinach, it will indicate this huge amount of iron. The problem is most people can't get the iron out. And so you need a very, very acidic stomach environment with an acidity, a pH down around 1.5 before you can pull the iron out of vegetables. Okay. So vegetarians, vegans really are facing kind of an uphill battle. Menstruating women are losing blood every month. So it's kind of an uphill battle to maintain those iron levels. Now, in menopause or after menopause, and in all men, adult men, I'm constantly trying to push the iron levels down. We want to tamp it down because as the iron levels go up, heart attack risk goes up, stroke risk goes up, and a dozen other disease cancers go up, et cetera. So it's a constant little struggle to keep those iron levels at the right place for each of these groups of people. So hemochromatosis, iron overload. The most common symptoms of hemochromatosis are severe fatigue, chronic fatigue, joint pain. And for some reason, I don't know the reason for this, but often it's the knuckles of the middle and index fingers that tend to suffer the most. And now that I've said I don't know, I'm going to have to go back and research this and see if I can find out what it is. Other symptoms when it gets a little worse are, well, I mentioned a lack of energy, but you can get abdominal pain, loss of libido or sex drive, and eventually an irregular heart rate. Now, testing, blood tests, you need to do several to diagnose hemochromatosis. First, they're going to check the level of iron in the blood, and they're going to do that. You can do it somewhat by directly checking iron, but usually they're going to check your transferrin saturation level. I'm not going to explain what that is here. Get our book that's coming out next month and we'll go into it. Well, actually, that's not true. It's the next book. Okay, you can check the amount of iron that's stored in the body, which is generally can be found by checking your serum ferritin level, or you can do a DNA test, a genetic testing, because these specific genes that increase the likelihood of hemochromatosis have been identified. The only problem with that is it's a nice background test, but a lot of people have all the genetic markers but don't show symptoms or signs with the blood test of severe hemochromatosis. So you'd want to check the ferritin and iron levels also. Now, that's the beginning. Now, if they show a problem, you're going to want to do further tests, because hemochromatosis, as I mentioned, is damaging to all of your internal organs. And so then you'd want to do tests for the different internal organs, right? So you'd want to do a blood test that's going to look at the liver. You may want to do a liver biopsy, et cetera. And so liver is the first place that I would look. By the way, there are other causes of high iron levels. You can have liver disease will cause high iron as well as be caused by high iron. People who get frequent blood transfusions, drinking beer from iron containers, which doesn't happen much anymore, but using cast iron pans. Now, usually it's not going to get you up to a level where it looks like hemochromatosis, but you will get somewhat elevated iron levels, particularly if you're cooking acidic things like tomatoes in the cast iron. People are on dialysis, et cetera. And there are a few other really rare things that affect the red blood cells. So liver damage. Liver's very sensitive to excess iron. And most people, by the time they're diagnosed with hemochromatosis, will have some amount of damage to the liver. Again, that doesn't cause symptoms at first. Actually, liver can be pretty damaged before you start having symptoms. You can get cirrhosis or scarring, but you'd see tiredness again, weakness of the muscles, loss of appetite, very itchy skin. So not little mild itching occasionally, but really itching. You get tenderness or pain around the liver. That's the liver hides under the ribs, on the lower ribs on the right side. And you get jaundice, which is the yellowing of the eyes and of the skin. Other things you can do at diabetes. Diabetes, as you all know, is a condition of blood sugar problem, but hemochromatosis can cause iron to damage the pancreas. The pancreas is what secretes the insulin. And so if that's damaged, you can start developing diabetes. Symptoms, classic ones, and I ask these of kids all the time and their parents, you need to pee a lot, especially at night, right? You're very thirsty. So you're constantly drinking fluid and peeing it out, and you feel very tired. Okay? Heart problems. If the iron builds up in the heart, you're going to get cardiomyopathy. Cardio being heart, myo being muscle, pathy being for pathology. So it's a heart muscle disease, and there you get shortness of breath, a lot of tiredness and weakness. Usually, this is so tired and weak that if you carry a bag of groceries from your car to the house, you're done. Swelling in the ankles and the feet. So then the question also, treatments. Okay. There is no Western treatment that's particularly effective. The treatment that's most done is phlebotomy or blood draws. You just keep pulling the blood out. Some people need it every week, some people not so often, but you're just taking the blood out because there's too much iron in the blood. There are drugs that will chelate iron. Chelate means to bind to it and carry it out of the body. It bonds to it chemically, and it'll carry it out of the body. Now, each of those drugs has some side effects. Some of them can't be used if you have kidney weakness because they get excreted through the kidneys and you'll get damage. But there are some that will chelate iron. Now, one semi-supplement, it's actually a chemical that can work, and it's the one that a lot of alternative practitioners use, is EDTA, which is four letters for a word that's about 10 syllables long. So EDTA, which has been used for decades to chelate and clear heavy metals from the body. It was used with submarine crews who were exposed to huge amounts of diesel fumes and got a lot of lead exposure, et cetera. And so EDTA has been used for that, but it also chelates iron. You could also lower your iron intake, which could help a little bit. If there's none going in, there's none to get on your blood cells. But you can do that by reducing your stomach acid, certainly not eating anything like meat when you're having an acidic product like vinegar or vitamin C. Don't cook in cast iron cookware, etc. There's lately been some information about using specific herbs. There's not a massive amount of research on this, but there is some. Acupuncture points I could go over with you. Basically, it's a matter of the underlying problems. You want to work on the spleen, pancreas, you want to work on the liver, you want to work on the heart, etc. But there's some very common points that I'm not going to go into right now. But basically, the Chinese call this shui sabing, or blood color disease, because the blood gets really black. Iron turns black, right? So there's too much iron in the blood. And so if you ever cut yourself and it looks really pale, you're probably anemic. If it looks really black, you may have hemochromatosis. So the blood color really does matter. Some herbs, Huang Qin, which is one of my new favorite herbs, Scutellaria bicalensis, we use for tons of stuff. We use it every day for all sorts of stuff. Now, when I was in school, I liked it, and it was in some formulas, and I thought it was kind of cool. But the new research is overwhelming. There's a compound in Huang Qin, that's Qin, called bicolin. And so we use an extract called bicolin, actually, is very powerful to lower inflammation in the lungs. So when Western medicine gives dexamethasone for lung inflammation, we give bicolin, which is not as strong, but it's very, very helpful. But it's also antibacterial, and it does chelate. It's been shown to chelate iron accumulations. So basically all the way around, it's a great herb. So Scutellaria bicalensis. And that's been studied pretty well. Second one is quercetin, which again, we use every single day for all sorts of things. But it's also a component of many Chinese herbs. In fact, most of the commercially available quercetin is an extract of certain Chinese herbs. It actually modulates iron biochemistry, aids iron chelation. So it is also useful. Milk thistle, or the extract silymarin, very effective at aiding all forms of liver illnesses and diseases, and it has been shown to detoxify the liver of heavy metals. Curcumin also acts in that way. Now, supplements, the key with supplements is, so there are tons and tons of antioxidants. Now, what's happening with the iron is it's oxidizing and causing damage. So using antioxidants is a key feature of it. Won't change the hemochromatosis, but it will help remediate some of the damage that was done. And again, the things I already mentioned, quercetin, milk thistle, N-acetylcysteine is one of the biggies, resveratrol, and there are a few others. There's an interesting thing that I read a little while ago, and I'm going to call it the Shelley Manning theory. I don't even know who Shelley Manning is, but I was doing some research and I came upon some information, and it made a ton of sense to me. And that is, there's a chemical called hepcidin, Hepcidin. And it is that chemical, hepcidin, that is primarily responsible for either carrying iron into the body or preventing it from going into the body. And typically in patients that have hemochromatosis, they have zero or very low levels of hepcidin. Okay. And so all the iron that's going into their system is being absorbed through the gut into their bloodstream. And so one key is to rebalance the hepcidin levels. Now, hepcidin is really affected by gut bacteria. So we're going right back to the gut. Pretty much any question you want to ask me will end up at the gut at some point. One of the keys to the gut bacteria and the hepcidin issue is butyrate. Butyrate. And butyrate is getting tons of press these days. I have several patients that have come in who started using butyrate before I was using it in the supplement form that are really getting really great results. Now, butyrate is one way to get it is it's a compound in butter, butyrate, right? And it's one of the fatty acids that's found there. So you can take a butyrate supplement, you could increase ghee, you could increase high quality butter and do some probiotics and get your hepcidin level changed. And that can help with hemochromatosis and probably help even more with lower levels of high iron. Okay? Yeah, I think that's all I'm going to say. I could talk about causes and effects and stuff, but I'm already running longer than I typically do. So until next Thursday, I want to thank you. I wish you happiness and great health, and I'll be back with you next week. Thank you.